Hi, it's Jim McKinnell, Director of the Office of Pre-Health Profession Student Development at the University of New Mexico, and I'm back with Planning for a Career in Healthcare. Today I want to talk about shadowing. It is a huge topic, and I think it's going to be a topic that's going to take me a couple of videos to get through in order to be able to share everything that I think is important for you to know about shadowing. But we need to get started. And we're going to start at square one, which is what is it and why do I have to do it? Shadowing has become an absolutely critical part of every successful application to a healthcare program. It's interesting, schools rarely will say that it's a requirement. My understanding is if a school says that something is a requirement for entry into their program, that they have to provide you with an opportunity to meet that requirement. So, and most schools, to try and find shadowing opportunities for all interested applicants it's an overwhelming task. And so schools are not willing to take on that responsibility. So instead, they have come to sort of recognize shadowing not as a requirement, but rather an expectation. So, and as I said, it is essentially a mandatory part of every successful application to a healthcare program. So you have to do it. And that's something that we need to be clear about right from the get-go. If you don't shadow, you will not get accepted into the healthcare program of your dreams. Now, why is shadowing becomes so important? The way I feel about it, and my understanding, talking to a lot of people that are involved in selection processes, is that it has kind of become pretty much the gold standard for evidence that you have made the effort to explore and try and understand the healthcare profession that you're interested in. And that's really important. So and you will all be asked at some point in the process, as you work towards that, as you work towards your professional goals, you will all be asked at some point, what do you know? What do you know about being a doctor? What does it mean to you to be a doctor or a nurse or a PA or a pharmacist? And you can tell people, oh yeah, I know all about being a doctor. I know all about being a pharmacist. But what they're going to be looking for in your application is evidence of that. And that evidence has become shadowing, almost first and foremost. So in essence, it's kind of become the gold standard. It is evidence that you have made the effort to explore and understand the profession that you're pursuing, and that with that understanding, you are still making the choice to enter that profession. So it's a big deal. It's a big deal. And you need to be ready to shadow. It's absolutely essential. So that being said, what is it? That's why we're being asked to do it. But what exactly is it? Shadowing is essentially attaching yourself to someone who's doing the work that you hope to do one day. And I don't mean physically attaching, but basically, yeah, almost. You're going to be hanging out with someone, and you need to hang out with them for a chunk of time. I often advise students that contacting someone for a shadowing opportunity and suggesting that you'll shadow for an hour is a waste of your time and of their time. Having been in the position in the past of having shadowing students, it's annoying to have shadowing students there for less than 3 or 4 hours. If you come for an hour, it takes me 20 minutes to remember what your name is. And then by that time the patient comes, and an hour wouldn't even give you a chance to see a complete patient interaction with me. So I think that when you're thinking about setting up shadowing opportunities, you want to think about shadowing for 3 or 4 hours, so a half a day with the provider that you're going to be working with. But once you get with them, once you're with that provider and you commit that time to them, what are you doing? Shadowing gives you an opportunity to watch someone do the work that you hope to do. Now, a shadowing experience isn't the same in every environment. So, for example, if you had the good fortune of having a pediatrician, say, take care of you the entire time you were growing up, or a family practitioner, and now you're a pre-med student and you contact them and say, oh, I really would love to come and shadow you. And you go to shadow them in their office. So they have their own private practice and you're shadowing them there. They set the rules. If they are examining the patient and they want you to feel the patient's belly because they think they feel an enlarged spleen, or if they want you to listen to the patient's heart because they think that they hear a heart murmur and they want to share that experience with you, you get to do that. But that isn't universal. For example, at the University of New Mexico, here where I work, the rule in our hospital is that shadowing students here is observation only. That is, you cannot touch a patient. And that includes, you can minimally interact with them as far as conversation goes. And you can introduce yourself to them and explain to them why you're in the room with their healthcare provider. But more than that really is not part of the program. Shadowing really is observation only. There's a very good reason for that. We do live in a litigious society. You know that people are suing everybody for everything. And for some reason, if you had the misfortune of being with a provider and they were working with a patient and something unfortunate happened, something bad happened, if you as a shadowing student were perceived in any way to be participating in that patient's health care, so in other words, if that patient or their family thought that you were part of the healthcare team, then there would be the possibility that you would be added or named in a lawsuit. Should that the results of the circumstances result in a lawsuit, you as a shadowing student could be named in the lawsuit if you were perceived as taking part in that in the patient's care. Our institution does not have liability insurance to cover shadowing students. Right? That there is no way that they can do that, and they're not willing to do that. So because of that, shadowing here is really observation. You cannot touch a patient. So if you happen to be with a preceptor and they heard a heart murmur and they took their stethoscope out of their ears and they handed you their stethoscope and said, "Oh my gosh, listen to this, it's a great heart murmur." As a shadowing student in our hospital, you'd actually have to take 2 steps back, thank them for the opportunity, but decline. You cannot take that stethoscope and listen to that heart because of the concern that because of that act, you might be perceived as participating in that patient's care. I know it sounds a little bit extreme, but it simply is they are the guidelines of our institution. And so I also want you to understand that guidelines dictating what you can or cannot do as a shadowing student are really determined by wherever you're doing your shadowing experience. Private practice, somebody's practice that owns their practice, they dictate the rules. They can have you engage in any way they want. Different institutions may have different guidelines. It is your responsibility, though, as a shadowing student coming into that institution to understand what those restrictions or guidelines are. But that being said, now we have a chance, though, to simply observe the interaction that occurs between a healthcare provider and the person that they're caring for. And that is an exceptionally complex interaction. Because remember now, you're going to be walking in the room with a provider who may not have ever laid eyes on this patient before. And yet the responsibility, the job of that person that you're with is to take care of that person. And I've talked a little bit in a previous video about the complexity of that notion. What does that really involve, taking care of someone? Well, now you're going to see it. And now you're going to have the opportunity. So in other words, not only understanding what a patient's medical issue is, what their problem is, what hurts, what doesn't feel right, what's giving them the fever, whatever their symptoms are, you're not only going to hear about their symptoms, but you're also maybe going to also hear your provider explore the circumstances of the patient's life. So in other words, every patient we meet is not just a set of symptoms. They are a real person that have real lives, that have real people that depend on them, that have real jobs and real responsibilities. And so their physical condition may be impacting on lots of things that are not a part of the patient's symptoms. And as an extension of that, the things that they may be most concerned about may actually not be their symptoms. Their symptoms have brought them to you. But the things that they may be most concerned about, the things that may be really playing on their mind, might be the fact that they're sitting here in your office or in this office and they're not at work. And they don't have sick leave. And if they're not at work, they don't get paid. And if they don't get paid, they don't have money to pay their rent and to put food on their table and to clothe their children. So there may be real concerns that they have not at all related to their symptoms. And yet, in order to take care of that individual, we need to sort of understand that. We may not be able to fix anything. We may not be able to address all of the concerns they have, but we need to understand the impact that their symptoms are having, not only on them as a physical being, but on the world that they inhabit. So taking care of a patient is a process. And as I mentioned before, it is a very complex process. And there are a lot of different variables that play into it. Now, historically, what we've done with pre-health profession students is we've kind of said, yeah, you need to shadow. And we've kind of shoved you into the room and we said, learn something. Or the expectation is that you would learn something from that. And I've also, unfortunately, had the opportunity to have conversations with administrators in our health professions, in our health sciences center, that, when I talk to them about shadowing, they look at me and they kind of blow it off. They say, oh, shadowing's a worthless experience. Students don't learn anything. And I'm like going, well, bad attitude, because not only is an expectation and a successful application not at our institution, but at every institution around the country. But could we at least take a step back and think for a moment, if students aren't learning something, if they're not taking the things away from the experience that we hope they will, why is that? We are not dealing, like you guys know, we're not dealing with stupid people. We're not dealing with people who can't learn. We are dealing with the very, very best learners. So why has this not translated into a really meaningful experience as far as shadowing goes? I think really strongly that it comes down to basically we've been very neglecting our responsibility, and our responsibility to our learners is to really at least give you an orientation, to sort of give you an idea of what you're going to be seeing when you walk in that room. What are some of the variables at play, and what are the things you might be looking at, thinking about, reflecting on? And that's what I want to help you do with the subsequent videos in this series. I really want to sort of break the experience down for you. I want to give you very, very specific things to look for, to listen for. I want you to be aware of efforts that are made by your provider to communicate effectively with the patient. And if there are obstacles to effective communication, if you've determined that effective communication hasn't happened, and you can do that as a shadowing student, you can make your own determination of whether or not the communication that's happened that just then has been effective, then we also need to sort of begin to listen for and look for and try and understand the efforts that are made then, if that's the case, of correcting that situation. How do we take miscommunication and turn it into effective communication? Which is the bedrock, that is the basis of everything that we do in healthcare, and really is the ultimate determining factor on whether we're perceived as a good healthcare provider or a bad healthcare provider. So really, really important. Clearly something I'm very passionate about. I want to take the time. I want to share some insights that I have and that I hope ultimately will translate into a more meaningful shadowing experience for you when you have those opportunities. I'm going to stop for today. Thanks so much for tuning in. This is Planning for a Career in Healthcare. Again, my name is Jim McKinnell. I'm the Director of the Office of Pre-Health Profession Student Development at the University of New Mexico. If you have found the video interesting or informative in any way, please tell your friends about it. If you have friends, and I know you do, who are interested in careers in healthcare, if they're unaware of these videos, please share them with them so that I have an opportunity to chat with them as well. Thanks again, and I'll see you next time.